November is Alzheimer's Awareness Month, and the holiday season may be a time to recognize changes in your loved one's cognitive abilities. Dr. Joseph Babion is a neuropsychologist at Unity Point Health, Unity Place, who conducts evaluations with adults who are experiencing changes in their memory due to Alzheimer's disease or other medical conditions. Good morning. Thanks so much for coming on and talking about this very important topic.
Good morning. Thank you for having me.
Absolutely. Well, first of all, let's just talk about it. What is Alzheimer's disease?
Yeah, well, Alzheimer's disease it's a brain-related condition that primarily causes changes in someone's memory. Okay, so older adults specifically, around 65 to 70 years of age and up, are at increasingly risk of getting Alzheimer's disease, age being the greatest risk factor of it. It's a progressive disease, meaning that unfortunately over time, once you have it, we can anticipate that symptoms are going to increase in severity year after year until someone eventually requires some assistance with daily living.
Right. Well, then let's talk about those warning signs for maybe family and friends who are seeing these. What are they supposed to be watching out for?
Sure. Well, if Alzheimer's disease is a condition affecting memory, the main types of symptoms to watch out for are memory-related signs. So specifically, memory for recent events. So maybe someone who is frequently misplacing items, someone who is asking a question and then a few minutes later re-asks the same question. These are all indicators that maybe someone's having difficulty with memory and could be a warning sign of something like Alzheimer's disease.
Right, and you work right with patients in this. So what is your role as a neuropsychologist in diagnosis and in treatment?
Yeah, so Alzheimer's disease, unfortunately, is also misdiagnosed in a lot of cases because there's no one test for it. So neuropsychology, we provide a unique source of information in that we actually test people's memory and we compare how they're doing on those tests to most people their age. And this allows us to distinguish whether the changes they're experiencing are normal for someone their age or if it might be something more than that, and if in fact it is something more, could it be something like Alzheimer's disease?
Right, and before we leave, what are the steps to getting help if someone is having these changes in their memory?
So just because you're having memory problems doesn't mean you have Alzheimer's disease. So the most important part is going to your primary care physician and making sure there might not be some medical condition or other cause that is contributing to changes in memory. Then your primary care physician will order tests such as labs, maybe to get a picture of your brain taken like an MRI, and then ultimately possibly to see someone like me to get memory testing completed. So primary care physician would be your first stop, and then they can facilitate the process to seeing a neuropsychologist or some other specialist to help out with that process of diagnosis.
All right. Well, thank you so much for coming on and talking about this important issue.
All right. Thank you for having me.
And we will share all of these details on our website, ciproud.com.